This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
It's a disease that might start off as being harmless, but when it progresses, it's anything but. More than 60 million people worldwide deal with the crippling condition called glaucoma, and many of them live right here on Delmarva.
Glaucoma affects your optic nerve. It can damage that nerve to the point where you can experience vision loss. But the experts at Chesapeake Eye Center are working to change glaucoma's progression by offering a new procedure to the Eastern Shore. Delmarva Life's Sydney Whitfield shows us how.
Dr. Catherine Smoot-Hasselness with Chesapeake Eye Center works with glaucoma patients all the time, so she understands the way that the disease can affect the eye.
Glaucoma is like your bathtub. There's either too much fluid coming in, so it builds up around your ankles, or not enough going out, so it builds up around your ankles. If you have vascular disease such as diabetes or high blood pressure, those are risk factors. Age is a risk factor. The most important part about detecting glaucoma and treating it is getting to it early.
And if you do catch it early, there have been treatments available for patients.
Typically today, our mainstays of treatment are medications, several classes of medications, or selective laser trabeculoplasty for the early stages of glaucoma. We try to catch it early and control it in that fashion. However, if the glaucoma progresses despite these treatments and goes to a more advanced stage, there are pretty major and complicated surgeries that can be performed for control that have been out there for a while.
She says those surgeries do have a tendency to have complications and are usually performed when the patient already has vision loss. But she says now there's another way to treat the disease.
Well, it's an exciting time in ophthalmology because over the last few years there has been development of what we call minimally invasive glaucoma surgery. There's several different techniques that are used. One that we're using frequently in our practice is the CyPass stent. And this is a 6-millimeter stent that is introduced into the drainage system of the eye, kind of bypassing that drainage system, if you will, that we do at the time of cataract surgery.
So, in other words, Dr. Smoot-Hasselness and her team will remove your cataract, put in an artificial lens, and then put the 6-millimeter stent in to treat the glaucoma. That stent will make that fluid leave the eye faster.
This is a handheld. This is exactly what we use in the OR. The very end of the tip is the stent itself. It is a 6-millimeter, I think it's polyacrylate, like a plastic type of device. And it looks like it has little rings at the end that keep it from going in too deep. And we just follow that right down into the little channel, and we push this button here, and the stent will release into the eye, and then this instrument comes out.
Not only are these surgeries done quickly, but Dr. Smoot-Hasselness says they're proving to be effective as well.
Now, what we have found here is that the majority of our patients are totally off of all medications after the surgery. Now, why is that great? That's great because medications are very expensive. A lot of people don't use them like they're supposed to. The medications can affect the cornea of the eye and aggravate dry eye. So there's a lot of really good reasons to do this. Most importantly, it's keeping that pressure low because of those people who are treated successfully with medications, 75% of them never need their medications again.
And she says there's barely any recovery time.
So really the next day, you're taking off your patch, you're seeing your doctor, you're off of your glaucoma medications with that eye till we see how that works. You use your eye drops like you would use after cataract surgery, your anti-inflammatory and antibiotic, and that's pretty much business as usual.
Dr. Smoot-Hasselness says she's looking forward to treating patients through this groundbreaking procedure.
We're very excited that we stay current with the newest technologies and that these services are available locally on the shore for our patients who do have glaucoma.
Now, Dr. Smoot says you should make sure to get your comprehensive eye exams early so that if you do have glaucoma, her team can detect it and use some of the new procedures.
Like any other ailment,
Yeah.
intervention is